Hi, welcome to oral pathology classes. We are discussing about the viral infections of oral cavity, and in this video, we are going to discuss a very interesting topic, that is your infectious mononucleosis or your kissing disease. Okay, now let's kiss someone. Okay, we are going to kiss someone. Okay, now infectious mononucleosis, we are going to discuss in the heading introduction, the clinical features, the complications, the oral manifestation, the histological features, as well as treatment of this infectious mononucleosis. It is a frequently asked a short note in your university grade examinations. Infectious mononucleosis. Okay, it is caused by Epstein-Barr virus. Epstein-Barr virus is the one causing this infectious mononucleosis. It is called glandular fever, or it is called kissing disease. Okay, you are very happy to kiss someone. Okay, now let's see what is kissing disease. Now, why it is called kissing disease? Because it is transmitted by intimate contact or kissing. Okay, so when you are kissing someone, make sure that that person doesn't have any infectious mononucleosis. See, there is nothing like that. It can also spread through the saliva. If you are sharing the spoon, if you are sharing the what your straw, okay, that can also cause this spread of infectious mononucleosis. And once infected, very careful, it can remain in your body for your lifetime. So very careful before you kiss someone. Okay, now let's see what are the clinical features. Coming to the clinical features of infectious mononucleosis, it mostly affects the children. It is going to mostly affect the is seen mostly in the children. And infectious mononucleosis, as there is a viral infection, you can see that there is fever, there is lymphadenopathy, and mostly it occurring in the oral cavity. There is pharyngitis. Okay, the pharyngitis in the oral cavity, and there is hepatosplenomegaly. Okay, as it is kissing. Okay, you should make sure. Okay, you should be very careful. Okay, now you should be careful, because when you get a kissing disease or infectious mononucleosis, you will have fever, you will have lymphadenopathy, you will have pharyngitis, you have hepatosplenomegaly. Okay, and as the age increases, the symptom decreases, because older people don't kiss much. Okay, nothing like that. These are techniques for you to remember. Okay, these are techniques to remember things. Okay, and complications are seen in children who are less than 4 years of age. Okay, so this is clinical features of infectious mononucleosis. What are the complications in children? See, this is very dangerous if it is occurring in children less than 4 years. There is a rupture of spleen. The spleen will rupture. Okay, because of the megaly, the spleen will rupture. There is thrombocytopenia. Okay, there is reduced platelets, and there is autoimmune hemolytic anemia. There is hemolytic anemias, neurological problems, and myocarditis. It can affect the heart of the children. Okay, see, the complications is mostly seen when the child, when if it is occurring in children less than 4 years of age. See how serious condition it is. Now the jokes are apart. Okay, now the jokes apart, when it comes to the children less than 4 years, jokes apart, how it will affect. There is splenic rupture, there is thrombocytopenia, there is hemolytic anemia. Okay, neurological problems and myocarditis, how bad it is. Okay, now coming to adult, what we can see in the adult, we can see the in adult it is okay. Okay, you will have a fever, and he will have fatigue, malaise, and you will have lymphadenopathy. No issues. Okay. Now, what are the oral manifestations you see? Okay, imagine you have kissed your partner, and you are on the next day morning you are having fever, you are having pharyngitis. Okay, you are having a fever of 104 degree Fahrenheit. Okay, you are pharyngitis, you have lymphadenopathy. Okay, now you are afraid whether I have got any kissing disease. So to check that, you go to the mirror and check your pharynx region. Okay, the oropharyngeal and tonsils will be enlarged. Do you have oropharyngeal and tonsillar enlargement? Go to the mirror and check after kissing. Okay, is there any petechiae on the hard palate? Can you see red spots on the hard palate? Do you got a necrotizing ulcerative gingivitis? If all these are there, yeah, definitely you have got the kissing disease. Okay, so these are all your manifestations. Now, don't worry, we have treatment. Okay, we have treatment here. Even if you have got a kissing disease, now we will treat it. Okay, it will usually resolve within 4 to 6 weeks. Wait for 4 to 6 weeks, or you can give supportive. If it is upsetting you much, if the patient is having pain or patient is having severe fever, we are giving antiviral medications or NSAIDs. Okay, this is about infectious mononucleosis or kissing disease, the Epstein-Barr virus. Okay, so you should think about the manifestations, oral manifestations, the pharyngitis, the lymphadenopathy. The most potential one is your complication in children. Okay, what are the complications and how you to treat it? Okay, that's all for infectious mononucleosis. Thank you.